Desloratadine, also known as Clarinex, is an antihistamine medication that is used to treat allergy symptoms. These symptoms include watery eyes, runny nose, itching eyes and nose, sneezing, hives, and itching. It works by blocking the natural substance histamine, which is produced by the body during an allergic reaction. This medication can be taken once a day, and the optimal timing is usually in the evening. It is important to follow the dosage instructions provided by your doctor for the best results. Before taking Clarinex, make sure to read the patient information leaflet from your pharmacist. Take this medication by mouth with or without food as directed by your doctor, usually once daily. If you are using the rapidly dissolving tablet, allow the tablet to dissolve on the tongue and then swallow, with or without water. If you are using the liquid form, carefully measure the dose using a special measuring device/spoon. The dosage is based on your age, medical condition, and response to treatment. Do not increase your dose or take this medication more often than directed. Make sure to tell your doctor if your condition does not improve or if it worsens. Some common side effects of Clarinex may include sore throat, nausea, tiredness, stomach upset, or muscle pain. Children may also experience fever, loss of appetite, diarrhea, or trouble sleeping. If any of these effects persist or worsen, it's important to contact your doctor or pharmacist. It's important to remember that this medication has been prescribed to you because your doctor believes that the benefits outweigh the potential risks of side effects. Most people who use this medication do not experience serious side effects. While it is rare, a very serious allergic reaction to Clarinex can occur. Seek medical help immediately if you notice any symptoms of a serious allergic reaction, such as rash, itching/swelling, severe dizziness, or trouble breathing. Please note that this is not a complete list of possible side effects, so if you notice any other effects not mentioned here, be sure to contact your doctor or pharmacist. If you are in the US, you can call your doctor for medical advice about side effects or report them to the FDA. In Canada, you can also call your doctor for medical advice about side effects or report them to Health Canada. Before taking Clarinex, make sure to inform your doctor or pharmacist if you are allergic to Desloratadine or Loratadine, or if you have any other allergies. It's important to talk to your pharmacist for more details about inactive ingredients that may cause allergic reactions or other problems. Before using this medication, be sure to tell your doctor or pharmacist about your medical history, especially if you have kidney or liver disease. Clarinex typically does not cause drowsiness when used at recommended doses. However, it's important to avoid driving, using machinery, or any activities that require alertness until you are sure you can perform them safely. If you are planning to have surgery, it's important to inform your doctor or dentist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. Liquid products and the rapidly dissolving tablets of Clarinex may contain sugar, and the rapidly dissolving tablets may also contain aspartame. If you have diabetes, phenylketonuria, PKU, or any other condition that requires you to limit or avoid these substances in your diet, it's important to ask your doctor or pharmacist about using this product safely. During pregnancy, it's important to use Clarinex only when clearly needed, and it's essential to discuss the risks and benefits with your doctor. Additionally, this drug passes into breast milk, so it's important to consult your doctor before breastfeeding. When taking Clarinex, it's important to be aware of potential drug interactions that could affect how your medications work or increase your risk for serious side effects. Be sure to keep a list of all the products you use, including prescription/non-prescription drugs and herbal products, and share it with your doctor and pharmacist. It's also important to note that Desloratadine, the active ingredient in Clarinex, is very similar to Loratadine, so it's recommended not to use medications containing Loratadine while taking Clarinex. Additionally, Clarinex may interfere with certain lab tests, such as allergy skin testing, potentially causing false test results. It's important to inform lab personnel and all your doctors that you are taking this medication. As for the daily dosage and optimal timing, it's best to follow your doctor's recommendations for the most effective use of Clarinex. If someone has taken too much Clarinex and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help. In the US, you can call your local poison control center at 1-800-222-1222. Canadian residents can call a provincial poison control center. Symptoms of overdose may include extreme drowsiness. Always take Clarinex as prescribed by your doctor and never exceed the recommended dosage. This medication is not recommended for use in children younger than 6 months old. If you forget to take a dose of Clarinex, take it as soon as you remember. If it's close to the time for your next dose, just skip the missed dose and take your next one at the usual time. Don't take an extra dose to make up for the missed one. It is important to store Clarinex at room temperature, away from light and moisture. Be sure to keep it in a safe place, away from children and pets. Do not flush this medication down the toilet or pour it into a drain unless specifically instructed to do so. When it is expired or you no longer need it, be sure to properly discard of it. You can consult your pharmacist or local waste disposal company for guidance on how to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.